It's a pleasure to be here today. Yes, I think Commissioner alluded to how challenging the last couple of years have been and the strain it's put on the mental health system within Chester County. So when the news of the hospital closures occurred, it was a huge impact to our mental health team, I can tell you, within Chester County government. And I say that because, quite frankly, the staff that operated an emergency room at Brandywine Hospital had created so many partnerships with the community. We had, as mentioned before, with the closure, we lost 64 inpatient beds, 16 geriatric, 16 eating disorder, and 32 adult. That's a huge impact on a already strained and lacking, if you will, of inpatient beds in not just the county, but the region. So when the announcement was made, as my colleagues from the county have said, a leadership group was put together and really started to track and identify what the gaps are and what they will show over time. We partnered really closely with Emergency Services, tracking the ambulance deliveries to the 3 remaining Chester County Hospital, Phoenixville, Chester County, and Paoli, and really partnered with those hospitals. Staff from mental health have been in communication with those hospitals on a weekly basis to understand what are the impacts of especially Brandywine Hospital being closed, because again, that hospital and emergency department and those inpatient beds provided a tremendous service to us and to the community at large. So trying to gauge that, trying to understand what the impact is, while also standing up new programs, expanding existing programs. We've doubled up a program that provides wraparound services for individuals that's going through a mental health crisis. And we think we are making progress, but there's still work to be done. And with that, I'm going to pivot a little bit to a process that had started prior to the announcement of the hospital closures, and that is the development of a mental health crisis response system and a planning process, which began at the end of last year, the end of 2021. It's brought together, as often does in Chester County, a lot of community leaders. We have representatives from the schools, law enforcement, the hospitals, obviously a number of county leaders and elected officials, with the intent of developing, if you will, a mental health crisis response system that really meets our needs. From Phoenixville to Oxford and Honeybrook to Westchester, all corners of the county. Obviously the size of our county is a challenge at times, so to be responsive to all areas is really a big component of our mental health crisis response planning process. We also recognize in that process that the need, unfortunately, does not, have an age limit, if you will. We have tremendous needs within our youth, our adolescents. Certainly our adults and seniors are all experiencing some of the mental health challenges that we've spoken to a number of times today. So to be responsive is really an important component to build, to create if you will, a series of programs and services that's intertwined with the community, with the schools, with the police officers, with our EMS partners, et cetera, is really a critical piece. So there's really 3 components to our mental health crisis response system, and these are based on best practices across the country. The first is a call center. It's a number that someone can call when they are in a mental health crisis. and it's a really important piece. We envision it being staffed by, we're calling them mental health first responders. So many of the calls that come in, the immediate service will be critical for that individual that's answering that call. So that's the first leg, if you will, of the three components. The second is a mental health crisis response team. So it'll be teams that actually engage individuals in the community. We are planning for an adult team and youth teams, because we recognize there are differences in how individuals will interact with each other and with the person that needs that support going through that crisis at that point in time. And then the third component, and this really connects, I think, closely back to the Brandywine Hospital closure, is a crisis stabilization center. It's a facility where, for a period of time, whether it's a few hours to a few days, an individual can work with staff to work their way through within that mental health crisis and go to services outside, if you will, that facility for a longer term or ongoing basis. So those are the three components. That planning process had started prior to the hospital, but the urgency of it got ratcheted up big time with the closure of the hospital. Now, I echo Commissioner Moskowitz's comment regarding the Haven Behavioral Health and their partnership with Chester County Hospital. I think that's going to be additional. We're hearing up to 60 inpatient beds, which will be a tremendous impact for our community and help to respond to the closure of the beds here at Brandywine Hospital. But we're still, we think, a year out from that service being available. So again, staff agencies are trying to continue to work with individuals in need and connect them with the resources that are available at this time. But it certainly is an important need in our community. So I think that as where we stand right now with our mental health crisis response planning process, we hope to have recommendations released in July of this year, probably 2 months out. Some of it is starting to come together in terms of the approach that we want to have, and I sort of highlighted some of that just now, but some of that will be clarified by some of our partners. We certainly want impact from our police partners, from our school partners. It was, again, Commissioner Moskowitz mentioned the task force that was put together by Representative Sappy. That's connected to this process as well, so that the partnerships of the community members throughout the community can really speak to what this new system looks like. I would end with this comment, though, or two comments, if I will, in terms of the challenges putting this together. I think we all know, and I want to sort of highlight the challenges around workforce that we have in the county, really in all different industries. But as we look to stand up a new system to serve our mental health needs in the community, that's certainly a challenge we have. And then the second challenge I'd mention is, as it relates to the Crisis Stabilization Center, as much as it is a huge need, it's not something a lot of communities want in their community, just to put that on the table. So we are certainly trying, at some point the community has to recognize we need this. It used to be in some form or fashion at the Brandywine Hospital, and it would be fantastic if it could be on the campus of what was the Brandywine Hospital or Jennersville Hospital. But it may not, it may not come together now in that timing. So just make those two comments around some of the challenges we foresee. But I am, thankful for the staff we have within the Human Services Department of the county and the efforts they've made to date.